Multiple myeloma is a cancer of plasma cells in the bone marrow. Despite advancements with new treatments including immunomodulatory drugs and proteasome inhibitors, multiple myeloma remains a fatal disease for most patients. Filanesib, also known as array-520, a KSP inhibitor with a novel mechanism of action, has the potential to address this unmet need. KSP is a motor protein, critical to the function of proliferating cells. Filanesib selectively inhibits KSP, blocking cell division. In contrast, terminally differentiated cells, such as neurons, do not express KSP and are not sensitive to KSP inhibition. As a result, toxicities such as neuropathy are not expected with KSP inhibitors. Proliferating cells express KSP, and targeted KSP inhibition induces mitotic arrest and apoptosis. Cell survival is dependent on the presence of MCL1, and MCL1 depletion leads to a rapid onset of apoptosis. Proliferating cells that depend on MCL1 for survival include hematopoietic cells and some tumor types, such as multiple myeloma. In cells arrested by KSP inhibition, MCL1 is rapidly depleted and not replenished. These cell types are expected to undergo rapid cell death following inhibition of KSP. Elsewhere in the body, proliferating non-hematological cells, including epithelial cells, are thought to rely on survival proteins other than MCL1, such as BCL2. Since minimal BCL2 degradation occurs during the intermittent time frame of drug exposure, non-hematological cells are not expected to undergo rapid apoptosis. This difference in sensitivity would predict limited non-hematological toxicity in response to KSP inhibition at the recommended dose level. KSP inhibitors represent a novel mechanism of targeting proliferating myeloma cells. Due to a distinct mechanism, KSP inhibitors are expected to be active, even in cells that have become resistant to immunomodulatory drugs and proteasome inhibitors. Based on this scientific rationale, Array Biopharma is developing Filanesib for patients with multiple myeloma alone and in combination with proteasome inhibitors and other myeloma therapies.